to order. Do I need a second? No? Okay. Welcome, everybody, to the Mental Health Board and putting in the request for proposals. We're going to start. We're going to try to keep on a 5-minute for each agency, and we'll ask the board if there's any questions. So let's try to keep on track, and let's get started. The first agency is Childcare Network of Evanston.
Good morning. My name is Carol Teskey, and I'm the Executive Director of the Childcare Network of Evanston, usually referred to as C&E. Our proposal for funding was entitled Learning Together, and our phone number is 847-475-2661. Our website is childcarenetworkofevanston.org, and our address is 1335 Dodge Avenue. We are located across from the high school and halfway to the Burger King. I want to thank you this morning for the opportunity for all of us to stand in front of you in person and really share our passion for the work we do. It's an opportunity that we don't often get, so I thank you very much for your time. C&E is an organization that provides both direct service and seeks funding for our partners in the Evanston community to support quality early education and supports for parents. Through our home visiting program, we provide direct service using early Head Start and Head Start dollars. We also partner with 2 early childhood sites to provide early Head Start and Head Start services, and we also have 1 family child care home located on Dodge. We are the community grant writer for Preschool for All state dollars. So that allows us to provide funding to 5 early childhood sites to provide preschool free for those children who have shown at risk for academic failure. And then we are also a CCAP administrator, meaning that families come to us to complete applications for state subsidies, those families who are working or in school. And we are able to process those applications and expedite them so that families can get to work and children can be cared for in quality settings. Then we have other grants that help support parents in other ways and children in other ways. So this actually is our 50th year birthday that we're celebrating. We have been supporting children, families, and early educators in our community for 50 years. It's never been as important as it is right now. With the news that over half of the children who are entering our school district kindergarten testing a couple months after entering as not being fully prepared for kindergarten, our work has never been more critical. It's not that the early educators are not doing their job. In fact, we are so blessed and lucky in Evanston to have an army of qualified, dedicated, competent early educators. It's that classrooms look different these days. Children, for reasons that we are all trying to figure out, are entering stressed, out of sorts, and unable to regulate themselves. And so that is the essence of the Learning Together program that we are asking for and asking to expand. Early educators need our help. As I said, they're competent, but their classrooms look different, and they need some support, they need education, they need professional development in order to successfully handle their classrooms these days. The Mental Health Board has supported us through the Learning Together program for many, many years. This year, we made the decision to drop our proposal for scholarships and expand our ask in the Learning Together program because we felt it could provide a greater impact for the children. So through the Learning Together program, we are able to deploy therapists, mental health therapists, speech and language therapists, into our local preschool classrooms and child care centers to help model for teachers in those classrooms, to help support in those classrooms, and to help parents understand what's happening and how they can help and be part of that process. We are thinking bigger this year in terms of Learning Together, so we have increased our proposal ask. If we are granted this money, we would love to expand to 2 more schools, at least 1 more school. But we do have 2 more schools in Evanston in mind that we have talked to who are craving Learning Together services. We are also hoping to expand the amount of time that the current therapists are spending in our schools for reasons I already stated. And we are also asking for 2 other things as a part of this expansion. And one is to provide trainings, community-wide trainings for early educators on topics such as recognizing signs of trauma, trauma-informed teaching, addressing challenging behaviors, and most importantly, because it seems as though there hasn't been as much training around this one, how to talk to parents about the needs of their children in the classroom. And lastly, we would like to be able to have a speech and language therapist, all of which are licensed and certified, provide or perform screenings for all the children in the Learning Together sites as a way of trying to catch early some of the challenges that children are facing. So thank you again for listening, and I'd love to answer any questions.
The schools that you were referring to, are these preschools?
Yes.
Okay.
I can name them.
Yeah.
Sure.
Understood, yeah.
It's Learning Bridge, Childcare, the McGaw YMCA Children's Center, Reba Early Learning Center, that's where we are now, and the 2 schools we've talked to are Puerto Abierta and Toddlertown, all in Evanston.
Any other questions?
So the last one you said was Puerto Abierta, so are you guys expanding into Spanish-speaking schools?
We would love to go there, and they have shown a need. We sent a survey and asked for how many Evanston residents, how many are low income, moderate income, how many have IEPs, how many have challenges in the classroom, and so they rose to one of the top schools.
Thank you.
Thank you very much.
YOU?
Good morning. My name is Jennifer Simpson Lee, and I'm the Chief Advancement Officer at Youth and Opportunity United, known as YOU. I'm joined by our Director of Clinical and Outreach Services, Melody Rose. YOU respectfully requests Evanston Mental Health Board funds for our trauma-informed youth and family services. YOU is headquartered at 1911 Church Street. Our website is www.youthopportunity.org. Our phone number is 847-866-1200, and I can be reached via email at jsimpsonlee, Leigh, @youthopportunity.org. YOU has served the Evanston community for nearly 50 years, meeting the emerging needs of youth and their families. In the 2019-2020 program year, we will serve 750 Evanston youth in after-school and summer learning programs at no cost to families. These youth attend the 8 highest need Title I designated schools in Evanston: Dawes, Oakton, Walker, and Washington Elementary Schools, Chute and Nichols Middle Schools, King Arts Magnet, and Evanston Township High School. The youth served by YOU face needs caused by systemic issues, including poverty, racism, family trauma, community violence, and limited access to resources and services. By providing holistic programming that recognizes the whole child, YOU ensures that youth have the opportunity to reach their fullest potential and succeed. We serve youth in 3rd through 12th grades. 53% currently are female identifying and 47% male identifying. A minimum of 71% of our youth are low income, as defined by recipients of free or reduced lunch. 93% of those we serve are youth of color, currently 56% Black, 18% Latinx, and 17% multiracial or other. Approximately 15 to 20% of the youth we serve have limited English proficiency. Our service model is unique. Our trauma-informed, relationship-based programs offer innovative and accessible social and emotional supports for low-income youth at their schools in school-based settings. Our programs embed youth and family counselors who are master's degree clinicians into our out-of-school time programming to offer services to youth in familiar and accessible settings. This fills a service gap for some of Evanston's highest need families. YU partners with schools, families, and other community partners to offer comprehensive programming. Our holistic approach considers the social, emotional, and academic needs of youth. Our YU clinicians continue to experience and respond to dramatic increases from our staff in referrals for clinical services. Some of the mental health supports that we offer include project-based learning that allows you to develop social emotional skills and build agency, competencies, and leadership. Psychoeducational groups, which are therapeutic groups that provide a low-risk entryway and offer an effective alternative for many refugee, immigrant, and low-income youth for whom traditional psychotherapy conflicts with cultural norms. Individual and family counseling supports improved family functioning, communication, and relationship building. Our family engagement activities foster support networks and build skill building for caregivers. And finally, we offer a trauma-informed, age-appropriate sexual health, healthy relationship program for our middle and high school youth that utilizes an Evanston-based curriculum and provides 2 separate weekly Safer Spaces group for LGBTQ+ middle and high school youth. These services are critical to meeting the mental health needs of underserved youth and families. YU serves the entire Evanston community through our school-based programs, our regular community programming and outreach from our headquarters located in the 5th Ward, youth engagement across Evanston through our street outreach program, and housing crisis support and homeless prevention across the community through management of our 24-hour-a-day, 7-day-a-week, as Melody can attest, crisis hotline. YU is fortunate to be based in a collaborative and generous community. Across our programming, we seek to work in partnership to enrich the lives of Evanston youth and families, avoid duplication of services, and close the opportunity to prepare youth for post-secondary and life success. Thank you for your consideration.
Any questions?
Yes.
For your therapeutic groups and the individual and family counseling, does that matter whether the families go to those schools you mentioned or just have to be in the 5th Ward?
So our programs, our clinicians support each of our school-based programs and we can receive referrals that way. However, with the housing crisis system, if there's any risk factors that are present within a family, then we're able to engage in individual and family therapy and that's to restore family reunification.
Question. Excuse me. How many youth are attending your LGBT social services?
In the specific group that Jennifer referenced,
Yeah, the Safer
Safer
Space,
Space,
yeah.
In the middle schools, we have, I believe, around 17 who come every Monday, and then on either in the afternoon at the high school program, we have around 20 who are currently active in it, and then we have 5 alumni who are also leaders and mentors with the group.
Thanks.
Thank you. All right, the next agency is Metropolitan Family Services, Family Support and Prevention.
Good morning. My name is Jennifer Jenks, and I am the Clinical Program Manager for Metropolitan Family Services, Evanston, Skokie Valley. I'm also the Direct Supervisor of our Family Support and Prevention Program. Metropolitan's Evanston Skokie offices are at 820 Davis, Suite 218 in Evanston, and 5210 Main in Skokie. The main phone number is 847-425-7500, and our website is www.metrofamily.org. Others on the leadership team are Roxanne Nava, Executive Director of the Evanston Skokie Valley region, and Haley Hansen, who is the Clinical Program Supervisor of our behavioral health programs. As I am telling you about our program, I want you to think about a father in his 60s who has not been in his 8-year-old son's life for most of his son's life, but who becomes the primary parent for his son after the son's mother passes away due to illness. The client and his son were thrown together and had to try to figure out how to become a family while struggling with their grief. So at the end of the presentation, I'm going to tell you how our program is helping them both. Our Family Support and Prevention program, FSP, has been serving vulnerable Evanston families for more than 20 years. FSP is a program that completely encompasses Metropolitan's mission of helping families to learn, to earn, to heal, and to thrive. In 2019, Metropolitan responded to an increased need for children's mental health services by expanding FSP to include direct mental health services for children, especially children without insurance. This expansion has helped to strengthen the whole family, and so far this year, we have provided services to 21 children from the total of 63 clients that we have served. We meet the priorities of the City of Evanston and the Mental Health Board because Family Support and Prevention addresses basic needs as well as mental health needs of the marginalized and vulnerable residents in Evanston. Our case management services link clients to resources for food, housing, and employment. And in addition to the services, the mental health services for adults, the expansion of services, we also provide the trauma-informed services to children of all ages. The percentage breakdown by race in calendar year 2018 was 23% African American, 64% Hispanic, 12% white, and 1% Asian and multiracial. And so far, in calendar year 2019, for the first 2 quarters, the breakdown is 24% African American, 68% Hispanic, 8% white. 98% of the client population that we serve is very low or low income, and many of the families are single-parent female households. The purpose of our program is to provide parents and their children with mental health interventions, to provide parents with tools that they need to be able to effectively parent their children, and to improve parent-child difficulties, thereby enhancing family functioning. As we strengthen families, we also reduce the risk of child abuse. The program works exclusively with Evanston residents, offers services in Spanish and English, and offers home-based and office-based services. We try to meet the clients where they are. The therapist has a master's degree and is bilingual, also has the domestic violence 40-hour training. The program focuses on families with multiple problems and helps to address core issues that impact the child and family functioning. We offer the counseling pieces, we offer case management, advocacy, parental support, and referrals as needed, and now for the child as well as the parent. The clinician works with the parents and the children to identify the problems and stressors impacting the family and also identify specific mental health needs, including depression, anxiety, trauma, and grief. The clinician assists parents and children in developing skills that meet their physical, emotional, social, and developmental needs. All MFS programs, including Family Support and Prevention, provide and receive data on outcomes through our Quality and Evaluation Department. We're proud of our outcomes, which include data from the Parenting Stress Index, which parents complete every 6 months, as well as data from the Progress Toward Treatment Goals, which are updated every 3 months. Additionally, MFS's high standards are acknowledged by its National Council on Accreditation status. MFS is truly grateful for the funding level over the past years. Metropolitan contributes 39% of the overall FSP program budget, with the Mental Health Board funding 61% of the program. Metropolitan's Evanston-Skokie Valley also has its own 9-member community board, and money raised through events supports our local programs. We continue to offer the Parenting Fundamentals program to FSP families in Spanish and English. One of the clients in the Family Support and Prevention program, a Hispanic female with 4 children, attended a class in Spanish for parents with children birth to 4, and this was in this year in 2019. After completing services, she wrote in Spanish on her evaluation form, and here's the translation. I learned how to be more patient and listen to my children's needs, and also to discipline without hitting them. I learned strategies to be a better role model to my children. I also learned to understand my children's feelings. I love this class, and I definitely will take it again. And she did. She had the opportunity to take another session of Parenting Fundamentals for children. This time, the age group for the children was 8 to 12. And she wrote on her evaluation, also in Spanish, which is translated, "What caught my attention was to talk to my children without yelling and without losing control. I learned how to set limits for the children, but also to involve them in the creation of the rules. I learned to pay attention to what they are saying, and now we have our family meetings." Our partnerships in the community are strong, and they include a group that the Family Support and Prevention Therapist co-facilitates with staff from District 65 at the Family Center in Evanston. MFS participates with the LAN and has coordinated the annual LAN Resource Fair in the past few years. FSP collaborates with the McGaw YMCA and sends children and families to Camp Echo. The therapist also coordinates with other MFS programs, such as child and adolescent mental health, adult mental health, and adult protective services to assist clients. I'm going to end the presentation by telling you about the father and the son who I mentioned at the beginning, and how they have benefited from the FSP program's wraparound services in the past year. So the client is a 61-year-old African-American male and a single father of an 8-year-old boy. The therapist began working with the client and learning more about his story and the parenting responsibilities that the client had after his wife had passed away. The client stated that he had a very limited role in parenting when his wife was alive. He did know his son, but he was not around in his son's life very much. And after her death, he knew that he had to and wanted to raise his son. The client did not imagine that raising a child would be as difficult as it is, and he felt isolated and angry. The therapist helped to reduce his depression and anxiety, and also provided case management support that was very vital to reducing his stress. In hearing of his struggles with parenting, the therapist recommended that he attend Parenting Fundamentals, and he did go to a session of Parenting Fundamentals. He attended all the classes and really was able to talk with the therapist about what he was learning in the classes and how he was applying it at home. And the therapist was then encouraging and helping him to apply what he was learning. He learned that, he talked to the therapist about the fact that he did not want to parent the way he was raised. And he said that all his parents knew how to do was to spank and yell, and he did not want to get into that pattern with his son, which he could already feel himself going down that road, and he wanted to break that chain. So he attended the classes, discussed what he had learned. He started to express the differences as his behavior was changing, of how his son's behavior was also changing. And with consistent rules and positive reinforcement and positive communication, he was able to see some changes. He shared that he also learned about his son's grief and how that grief would be affecting his son's behavior, and how he could respond to the grief instead of to the behavior. The therapist helped to reduce stress in other areas, including case management, and he needed to find a new apartment and get a 2-bedroom apartment so that his son would have a room. So they worked on getting him an apartment. They also worked on connecting him with resources for furniture. And they were able to find a resource that actually provides free furniture and will all the major furniture for the apartment. He was able to get. This reduced an incredible amount of stress that he was going through. In terms of the 8-year-old African-American male, here's a little bit about his story. It was very hard for him to talk about his mother's death, as it would be for any child. And when he was asked to express his feelings, he would stay really quiet. He never quite knew what to say. He was having behavior issues at home. He was also having behavior issues at school. And the family actually came through a school referral and when they realized that he needed extra support. One of his biggest struggles was communicating with his father. He had always been used to being with his mom. And going from his mom to someone who was essentially a stranger was very difficult for him, and it was a challenge, as it would be for any child in this situation. When the client began working with a therapist, he was shy. He would answer questions with one word, but she engaged him in activities. She engaged him with games and other activities that were therapeutic to help him to express his feelings and help to reduce his stress during the sessions. He started to be able to open up and talk about his mom. He could talk about his sadness, and he could also talk about happy memories that he had of her. He was also able to start being able to really communicate with his father, and something that he actually didn't think was going to happen. He didn't really feel like he could really talk to Dad, but over some time and doing the work, they both were able to really communicate with each other, and they also were able to start enjoying each other. So one of the things, they were able to go on an opportunity where Metropolitan sent them with many clients to the circus, and that was an activity that they were able to go to. This client was also able to go to Camp Echo, so he spent a week at Camp Echo through our partnership with the McGaw YMCA, something that he had never done, and he loved the experience, wants to go again this year, and I expect that he will. The clients are continuing their services to keep on building this positive relationship and expressing their feelings about their grief. This type of success through intensive work with clients would not be possible without the support of the City of Evanston and the Mental Health Board, and we request continued funding to keep empowering Evanston families. Thank you.
Any questions, comments?
It's get the opportunity to go to Camp Echo.
We generally send 8, and it would be 8 kids from our programs in Skokie and Evanston, and usually about half of those are programs that are specifically family support and prevention clients.
That's awesome.
What percentage of your board and staff are people of color?
Yes. You know what? And I do not have that information directly. I do know that it is in our application. But we have, so I can't give you a specific percentage, but Metropolitan is a very diverse agency in terms of the leadership. We have very diverse leadership, African American, Hispanic, Asian. I am, in terms of our staff for FSP, I am Asian. We have Hispanic therapists, and we make a real commitment to hire bilingual and Hispanic staff, or staff who speak the language of the community that they might be working with. So.
I have a quick question.
Yes.
I appreciate that you don't have a wait list, which is really impressive
Right.
in the midst of all these needs. How long would you say on average a particular family might be engaged with your services?
So the average is about 6 months. So we do have some families that have been in the program, and they can actually stay in the program for several years. We have other families who might be in the program for a shorter amount of time, so it could be 3 to 6 months, depending on what that family needs at that time. So we have the opportunity, because of the flexibility of the funding, to really offer them what services they might need. Sometimes a family comes into services and they want to be linked with something specific and don't necessarily want the longer counseling piece. Others would want the longer counseling piece. And so we're able to stay in for as long as we really feel like they need the help and they want the services.
In the application, it says that there are 13 professional staff and 9 are staff of color. But I believe, correct me if I'm wrong, this speaks to the broader metropolitan agency,
Yes.
not necessarily the program.
Correct.
Anything else?
Thank you.
Thank you.
Next, Trilogy, Evanston's mental health program.
Hi, good morning. My name is Megan Miller. I'm the Director of Intake at Trilogy, and here with me today is Maggie McGinnis, and she's our Program Manager of our Intake Department as well. Our office is located at 565 Howard Street in Evanston. Our main phone line is 773-508-6100. Our website is www.trilogyinc.org. And my email is mmiller, so mmiller@trilogyinc.org. And my direct line is 773-382-4005. We are requesting funds from the Evanston Mental Health Board of $30,000 this year. We are requesting this funding to help us continue in our efforts of outreaching, providing street outreach, intake and assessments, and linkage to care to individuals in the Evanston community. Our sort of bread and butter at Trilogy are our intensive outreach services, so team-based models of case managers, or what we call recovery counselors, that are providing outreach into the community to help support people with mental illness. A big component of the role that is funded by the Evanston Mental Health Board is a linkage worker that is specific to the Evanston community to help work with our partners, help support highest utilizers of emergency services and crisis services. We are at Hilda's 2 days a week, and we utilize a model called open access, meaning people can sort of drop in and engage with that linkage worker to sort of identify what some of their needs are. There's a huge collaboration on the part of the nurse staff at Hilda's, the psychiatrist, and the case workers there at Hilda's. And so a lot of times we are receiving direct referrals from those staff that are seeing folks accessing the Hilda's services and staying the night, utilizing the drop-in center, seeing the nurse and the psychiatrist. This year, we've continued to be able to increase our efforts with street outreach. A big component is being able to reach transient populations. Not everybody does utilize Hilda's or drop-in centers, and are more comfortable sleeping in the street or riding the trains or in parks. And so a big component of the linkage role that is funded by the Mental Health Board is to be able to go out into the community and outreach individuals that may need supports. It doesn't even necessarily have to be specific to mental health, but there gives an opportunity to be able to engage somebody around a variety of aspects, from basic needs that oftentimes does lead to offering additional supports for mental health. One big component that we've been able to sort of add here is our partnership with Housing Forward. They offer what they call Main Street vouchers to individuals that could live in the north suburban areas. And so that's been a huge resource and a big part of the partnership with Hilda's. St. Mark's Church, where they have drop-in hours, and a lot of folks utilize those hours and resources, where we've been able to work with individuals, their individual supports in the Evanston community, to get them housed with these vouchers and then provide ongoing care, specifically mental health, with our outreach services and helping them access medications, primary care, and psychiatry. What we have seen also this year is just an increase in utilization of the drop-in center at Hilda's and St. Mark's. St. Mark's has folks sleeping there, and they offer meals, and we have developed a strong partnership with them to reach those individuals that are utilizing those services. And a big component of what this funding allows us to do is really build relationships with individuals. We recognize that it's not easy for somebody just to utilize a drop-in service and just say, I need all of these things. It takes time to build trust. It takes time to demonstrate the respect for that individual, showing up, and a big component of that street outreach is to give us the opportunity to keep going back to individuals that may be resistant or hesitant to engaging the individual in a conversation or identifying some of the needs that they may have. And so that's been a really awesome component of this work that we're doing in the community, and that what this funding allows us to do is like work with individuals that require several touch points before they're interested in care. Working with individuals that may not have insurance, or they've had insurance and because of their homeless situation or struggles with mental health, they've not been able to maintain that insurance. I think also a big component of helping people find housing is the level of income. Folks either are, do not have benefits or any source of income, or unfortunately have a source, but it's not sufficient enough to live on. And that's a really big component of these partnerships with helping to house people, helping them access resources that are available to them, and sort of offer that big wraparound level of support. The role that is covered by the Evanston Mental Health Board funds is a unique role. This individual offers both street outreach services in conjunction with staff from our other teams. We recognize that she is just one person, and utilizing staff that are able to increase those efforts in the community has been really helpful. They also offer intake and assessment services. Oftentimes we're having touch points with individuals that have never received any sort of mental health supports or care, or never have even had an assessment to sort of identify maybe what some of those needs are. And this individual is trained in that area and able to provide those resources and supports. And lastly, a big component of that is our case management linkage service. We have a linkage team that this individual works very closely with that allows us not to have a wait list, where we can sort of transition folks from care so that they don't ever experience a lapse in sort of those wraparound level of services. And so that is one big component of the work that this individual is doing. Historically, we have served the 18 and above populations through the case management, street outreach, intake and linkage services. But the last few years, we have developed a child and adolescent program that focuses on children from ages 6 into early adult years. And those services are specific for groups in therapy, and we're expanding those services to offer therapy-specific supports in elementary schools in District 65. And we're beginning discussions of what that partnership would look like in conjunction with the work with the social workers, the school psychologist. And so we hope that we see those efforts and the expansion of that support really grow in 2020, and it allows us through this funding to be able to continue our expansion of those services and supports. Lastly, what we have seen with our population that we're serving in Evanston is highest utilizers of emergency and crisis services, which I mentioned briefly at the beginning. And a big part of this role really allows us to reach individuals that are utilizing crisis and emergency services to meet basic needs because they don't have a place to live.
Call the meeting to order. Do I need a second? No? Okay. Welcome everybody to the Mental Health Board and putting in the request for proposals. We're going to start. We're going to try to keep on a 5-minute for each agency, and we'll ask the board if there's any questions. So let's try to keep on track. And let's get started. So the first agency is Childcare Network of Evanston.
Good morning. My name is Carol Teskey, and I'm the Executive Director of the Childcare Network of Evanston, usually referred to as C&E. Our proposal for funding was entitled Learning Together, and our phone number is 847-475-2661. Our website is childcarenetworkofevanston.org, and our address is 1335 Dodge Avenue. We are located across from the high school and halfway to the Burger King. I want to thank you this morning for the opportunity for all of us to stand in front of you in person and really share our passion for the work we do. It's an opportunity that we don't often get, so I thank you very much for your time. CNE is an organization that provides both direct service and seeks funding for our partners in the Evanston community to support quality early education and supports for parents. Through our home visiting program, we provide direct service. Okay.
Just want you to know there are a couple of questions at the end of the application, and
Mm-hmm.
we can include others and give you the space to
Respond.
Yes.
Okay.
So-
Are you
sorry,
getting
Jen.
referrals from ERs?
Say that again?
Are you getting referrals from emergency rooms?
Yeah, so we have a 1-800 crisis line that's used for the community. That is 24-hour line, and a quality mental health provider or a licensed clinical social worker are the ones on call with that phone. Right now, it's sort of week shifts where they're on call. And so typically the crisis workers will call that phone line and say, hey, we've got so-and-so here, looks like they're struggling with X, Y, and Z. They're not eligible for an inpatient psychiatric stay, and we will be discharging them back to the community as they're an opportunity for you to come in and engage this individual, which allows us to be on the emergency room unit fairly frequently. And we do see, several individuals that we're engaging maybe at Hilda's on our outreach efforts at St. Mark's that sometimes utilize those emergency services. And so that allows us to continue to sort of build that rapport and relationship with that individual to help meet their needs. Yeah, Sandy.
What prompted your work with the District 65?
Say that again?
What prompted your work with the District 65 children?
So we did receive a small $5,000 grant from the Evanston Community Foundation to expand our child and adolescent program specifically in the Evanston community. And our work with the director indicated some additional supports for therapy and particularly possibly groups in the school setting. And so that was also, I think, based on some of the calls that we were getting on our referral line. Our child and adolescent program, the location is housed in the city of Chicago, but it does allow us to serve other communities. And although we don't have an office in the city of Evanston, our partnership with the school system sort of allows us to reach those populations that have identified a need.
Are you in specific schools or?
So not yet. We have worked with the director of the district to identify the two or three schools that would benefit from those types of supports. And the first schools that were identified were Oakton Elementary and then Dawes Elementary School. So we are not yet in those school systems. I think we're in the very beginning stages of identifying best referral platforms, how to support the staff that are on site, maybe address any gaps in service. So I think it's specific to probably therapy and group supports. Of course.
Okay, thank you.
Yeah, thank you.
All right, next we have NAMI.
Good morning, everybody. My name is Nathaniel Ekman. I am the Executive Director of NAMI, Cook County North Suburban. I'm joined by Christine Somerville, who is our Programs Director. She's passing out the handouts that you see in front of you that give an overview of our programs and services. NAMI is the National Alliance on Mental Illness. We are the local affiliate serving the northern Cook County suburbs. And our phone number is area code 847-716-2252. Our website is www.namiccns.org. And we're located in Skokie, in the Turning Point building at 8324 Skokie Boulevard. We're requesting of the Mental Health Board $15,000 to provide increased family education and support services for mental illness. The mission of NAMI Cook County North Suburban is to give help and hope and to improve the quality of life for individuals with serious mental illnesses and their families and those who love and care for them. We do this by providing education, advocacy, resources, and support. Our overarching goal is to eliminate the harmful stigma associated with mental illness. We do this through 23 programs across 17 communities in our catchment area across North Suburban Chicago, from Lake Michigan to Mount Prospect, from the city line with Chicago to Highland Park and Glencoe. In a year, we provide almost 1,000 warm line assistance calls, staffed by our resource specialist. We provide 4 instructional classes in family to family, basics for parents, a family refresher workshop for alumni of the family to family class, and a program for veterans called NAMI Homefront. We also offer a series of 14 support groups. Some of those are repeats of the groups. These are connections for individuals with serious mental illnesses who benefit from meeting others who have been there, forming supportive networks. Balance for Success and Dual Solutions are specialty connections support groups. Balance for Success is for adults typically 18 to mid-30s who are working to get back into school or back into work as part of their recovery. Dual Solutions, which has met at Vineyard Christian Church on Howard Street, is for individuals who are struggling with a substance use problem as well as a mental health condition. We also offer family support groups, parent support groups, veterans support group led by a clinical psychologist, equine assisted therapy, and a social group called Sundays at 1. And finally, we provide community education forums and a program called NAMI Reads at various sites in the community. In the most recent program year, we served almost 5,000 clients, I think 4,571 when you add the numbers together. The numbers in Evanston served, depending on how you count, it's somewhere between about 250 and 1,000, which I know sounds like a huge range, but again, it's depending on direct service versus indirect service, and of course, when you add in online contacts, social media, the number goes much, much higher. We do all of this with an annual budget of just $403,000, with 10 part-time staff members. In full-time equivalent, that's about 4.5 people. And we maintain a series of partnerships in the community, including in Evanston. We work with Northwestern for a program called NAMI on Campus, which engages undergraduates in the mental health field and in promoting recovery and awareness on campus. We have partnerships with the Evanston Public Library, Evanston Police Department, Beth Emmett, Sherman United Methodist Church, Vineyard Christian Church, as I mentioned, and Evanston Hospital, North Shore. What differentiates us from some mental health providers is that we provide what we think of as wraparound services. When somebody exits the hospital or outside of the relationship with a psychiatrist or a psychotherapist, the question is often, what do I do? I've got my prescription, I've got my diagnosis, what am I going to do to survive and lead a full life? We provide all of our services absolutely free of charge. In some cases, we ask people to make a contribution if they feel willing and able, but any service we provide is open door accessible, nobody is turned away, with the exception of family to family, one of which meets in Evanston. That group maintains a waiting list due to the popularity. But everything else is free. We're supported by township funding, local governments, private institutional support from foundations and corporations. The largest share of our fundraising support comes from a fall walk, which took place on the Northwestern campus last month, a spring gala, which will take place in Glenview, and then an annual appeal and individual giving. If we receive a grant from the Mental Health Board of Evanston, it will allow us to increase our program offerings specific to the city of Evanston and across the full catchment area, but we'll focus heavily on the services we're providing to this community. Any questions?
Yes, a couple of questions. What is your partnership with the library?
They have hosted presentations and educational forums for us. Their social worker has provided guidance and advice to us on mental health related questions. We have pretty good relationships with the staff there. They've indicated their willingness to host us for future events and serve as a resource.
And how would you increase your services to Evanston residents? I mean, with an additional grant?
With an additional...
With a grant.
With a grant. A huge part of our expenses in delivering any program, including those in Evanston, is the promotion and marketing of the program. So advertisements on social media that are paid, direct mail, distribution of flyers, printing costs. The costs of administering and promoting and growing our programs are pretty evenly borne across those activities and paying our staff to do the work. So it supports all of the above.
Do you have any statistics on the demographics of the Evanston patients and families that you guys serve?
We have some statistics. In general, we take the census data in grant applications and elsewhere for the proportions of Evanston residents who are members of specific groups, and we generally assume that those proportions are represented evenly in our programs and services. That isn't always the case, though. I should mention that the partnership with Sherman United Methodist Church is a new group called Breaking the Ice, and it's directed specifically at communities of color, Black and brown communities.
I think another point here is that while we have programming currently in Evanston and would like to increase our programming, we often work with the public library for our community education outreach, and you'll see in the packets that I passed out that next Tuesday we have a program on Social Security disability. But it's important to note that a lot of times families will seek our services outside of their own immediate community. So while we have the numbers, I think, in our grant application of who we serve specifically from Evanston, it's not an exact number because people will often go outside of their community because of stigma to get services. So for example, if we have a family-to-family class in Lenco, we would likely get Evanston residents. They often don't want to sit around with people that they go to church with or work with. They'll go to communities other than the specific community. So there's that fluidity of where people take advantage of our services.
Right, you're less likely in some cases with some programs to come to a program offered close to you. That's the irony of it.
I have a quick question about the size of and the depth of the program that you offer at Northwestern University.
So this is a new partnership, and we have established through their guidelines a club, a NAMI on-campus club. We've had 3 activities for the first 2 years there. We had participation of students and some of their staff in our recent walk. And what we're trying to do is grow that and perhaps bring a new program that we're offering mental health first aid to the students on that campus. So we're in communication with the faculty advisors to try and make that happen.
We also have a relationship with counseling services, counseling and psychological services in Northwestern.
What do you mean you have a relationship with them? I mean, describe that relationship.
So the director, Dr. John Dunkel, is an advisor to the club, and his associate, Dr. Steve Matthews, is also someone that we work with to strategize about how to bring more education to the students. So there's 2 staff members that are associated with CAPS that we work directly with that also advise the club there.
Other questions?
Thank you.
All right, thank you.
All right. Next, peer services, please.
Good morning. My name is Maureen McDonald. I'm the Executive Director at Peer Services, And our phone number is 847-492-1778. And that phone is answered 24/7. That is the best way for people to reach us. Thank you all for your service to the community in helping to sort out how to build and sustain the infrastructure of human services and crisis services in Evanston. I was struck this morning by how many of my colleagues, other executive directors of other organizations, are here before you today, and the extent to which we all have come to work together over the last 3 years. So even though we're here representing our own organizations, there is this interconnected web that I think Evanston Mental Health Board helps to support that as well. And to keep us we're all rather feverishly focused on how to keep building the human services infrastructure and community together. So back to peer services specifically. So we are the community-based substance abuse treatment and prevention provider serving Evanston. We provide services on site at our location in downtown Evanston, 906 Davis Street, as well as at Evanston High School and at District 65 schools. We are also the community prevention provider for Evanston and surrounding communities, and we serve basically all 3,400 students at ETHS on the prevention side, as well as providing education to parents, faculty, students about better ways to address drug and alcohol use among students, with the goal of preventing onset, or at least delaying it for a really long time. And so we've been serving the Evanston community for 44 years. We were actually formed at the request of the Evanston Mental Health Board quite a long time ago, I guess. And we are always looking for ways to help our individual clients and the community address the persistent challenges that drugs and alcohol pose. We are at a particularly interesting time with the expanded availability of vaping, which has proved to be rather dangerous, and the pending legalization of marijuana in January. And so a lot of our strategic thinking is around how do we support the community in this time. That's very much in formation. I'm happy to take questions about that if you like. Our core work is to provide both hope and pathways out of danger for people, teens, young adults, working people, parents, families, and even grandparents. Our youngest clients are 12. Our oldest client today is 90. And people really across the lifespan find themselves that their coping strategies have become overwhelmed by whatever's going on in their lives. And that may be a recent trauma. It may be an old trauma that has resurfaced. There's lots of ways, that people come to over-rely on alcohol and other drugs to try to solve a problem. And our job is to help them navigate their way out of that. So while we work with people on reducing their use, the more important work and the deeper work is to help people build more coping skills, figure out how to address what's going on in a way that they can do it without feeling the need to use. And for the most part, our clients are very successful, and we are enormously proud of what they do. We are guides, we are support, we provide structure, but we are, our ability to stay with them over the long haul is part of what separates us from and distinguishes us from other kinds of programs in our field that may be much more short-term in nature. Most of our clients have significant trauma histories. That is not unique to peer. That is across everyone who comes into substance abuse treatment. And men and women, whether it's from childhood sexual abuse or violence people have experienced in the community during incarceration, it's across the board, all kinds of different reasons, and often they accumulate together. And so we help people try to unwind that as we're helping them build alternatives. We did pay special attention to the Mental Health Board goals and the City Livability goals in our application. Our question 3 provides our answers very specifically. But because more than 80% of our clients are low income, because a lot of our clients have suffered through the war on drugs or suffered through excessive sanctions application because of either their how they come across, structural racial thinking about who uses drugs and who doesn't, which is usually wrong, and all kinds of bad application of laws. Those are the core things that we feel we're doing to address those goals in Evanston, and we're very grateful to have the continued opportunity to do it. So our goals when we're working with our individual clients, and that is the work that the Evanston Mental Health Board supports, are to help people reduce and eliminate drug and alcohol use, increase their involvement in school or work, and increase their social support, especially their peers who are not using, because those are the things that actually help people establish their way forward. And those are actually success measures that are across our field that we are required to respond to. So we do. Talked about that. I wanted to share sort of 3 new developments at here. Okay. 3 new developments at Peer, and share 2 very different success stories with you. So one is, I mentioned earlier that the nonprofit executive directors of human service organizations have been spending a lot of time together. Through Evanston Cradle to Career, which we all participate in, there is a grant that the Moran Center took the lead on. It's now kind of called the Collective, mostly because we don't know what else to call it. But our goal is, as a group, to listen more deeply to the community, especially to teens and young parents, about the barriers they face in accessing all of our services. And so that's become a very important initiative for us. And there's been a survey out in the community for, I think, 4 or 5 months now, and we're getting close to the end of that survey period. And so we don't have the results yet, but we're very much looking forward to them. And so any of us can update you on that going forward. We have also, kind of at the high crisis end of our services, we have been working on building a partnership with St. Francis Hospital to address people who come into the emergency department with opiate intoxication or acute alcohol intoxication, or whose other medical conditions are complicated by their use of drugs and alcohol. We were very fortunate to receive a small grant from the Evanston Community Foundation that allowed us to put up a pilot project from March until July of this year. We were only there 2 shifts a week, but they found 31 people in those shifts that they wanted us to work with, and most of them we were able to help in one way or another. Our goal in this project is not necessarily to bring people to peer, because we may not be the appropriate level of care, we may not be close to where the person lives even, but to help people who are showing up in crisis in our community and figure out how to help them take the next right step. St. Francis has been very welcoming, very grateful, and we are currently working with them on how to expand that partnership and make it a permanent part of their infrastructure. And I think we're pretty close, so hopefully we'll have some good news for you soon on that. But that's been very educational for us and has helped us think about our services and what the community needs from us in a different way. I wish I could tell you that the need was going down. It's not. But that's okay, because we know what to do about it. The last thing I wanted to mention is last year we had been asked in this hearing about what our goals were around fundraising. And so I wanted to let you know that through a lot of consultation, our board increased our goal for fundraising from last year to this year by 45%. So it's now $161,500, and I count every dime, so I pay a lot of attention to that number. And we have joined the Evanston Community Foundation's Building the Future initiative, which is a major gifts capacity building donation approach. We're having some success. We've changed our staffing arrangements and kind of how we're doing things, and we're making some progress. I'm very hopeful that we'll actually meet our goal. But it is a process over time, for the board, staff, and everyone to develop the capacity to really to do this. But we're hopeful that also with the attention that drugs and alcohol use are getting in this moment, that we can accelerate some of that as well. So finally, I want to leave you just with one success story. these are the kind of stories that help me when I spend my days focused on spreadsheets or talking to donors or trying to, write grant applications that help me keep going. So I'll share this one with you. So we had a young man who got a ticket in school for possessing vaping equipment last spring. And he did go to court, and the court said, well, you have an option, which is to participate in counseling services through peer services. And he did that, and we worked with him through the spring. And that seemed to help him, and may help him make some decisions. Came back to school, got caught right away again, because this is what happens with teenagers, right? It's like a process. Fortunately, the court sent him back to us. And so he, honestly, he did it himself. Between the time that he was sent to us by the court and the time we met with him, he said, all right, this is stupid. I need to change who I'm hanging out with. I need to spend more time with my mom. I need to talk to her about the stress that I'm experiencing, and because this is not, I don't want to keep going through this. And so we were so proud of him. His mom confirmed that all this, in fact, was what was happening. He made some really good decisions, and that's our goal. Our goal is to help everybody who comes to us just understand the consequences of their choices and make good decisions. So as I said, we're enormously proud of him, and I think you all can. Thank you. Can I take any questions?
So I would like to hear a little bit more about your approach to the upcoming marijuana legalization and
Sure.
what you're planning to do for that.
Yeah, it's definitely a change. We're all going to be sort of navigating through this together. I don't know if any of you have taken a look at the law, but it's 450 pages long, so it's pretty dense and hard to get through. So I try to boil it down for myself and my team, like how are we going to think about this? And what we have come to understand is that essentially what's happening is we're moving marijuana from this column, which is illegal drug, to this column, which is like alcohol, right? Available, regulated, not legal if you're under 21 to possess or use, but more available, right? And I think one of the things I think about a lot is that there's, I think especially for teenagers, this sort of perception that, well, if it's legal, that means it's not dangerous, right? And we all know that's not the case for alcohol, let alone for, other substances. And so our goal is to continue to use evidence-based prevention strategies to encourage people to delay their onset of use, right? Wait till you're a little bit older. We know a lot from how brains develop that the brain really matures around 25. That's a very long time for a teenager, right? But any month, every year of delay makes a difference. We tend to see that kids who start younger are more likely to develop significant problems over the course of their lifetime because of the way it affects like the reward structure in the brain and just their functioning. So that's really kind of our primary goal is let's be clear about what's happening and what's not happening. And let's be clear about what some of the problems are. There are some really interesting differences. If a teenager drinks a beer, they're going to feel the effects of that pretty quickly. We are reading and learning from our clients that for example, with edibles, the metabolism is much slower, and so people will have more and more of them because they're looking for that effect, and then all of a sudden they're in the hospital, right? Because it's just way too much. And so we're learning a lot, I think. We have ways to regulate doses of alcohol by proof, and that's all extremely standardized throughout the alcohol industry. That's really not the case in marijuana. Like, we don't quite have that science, and that information is not available to consumers. And so when we talk to young adults and other adults about responsible use, don't use and drive, right? Very bad idea. Could have all kinds of consequences you don't want. And also to be thoughtful about that process, that metabolic process that's still a little bit unknown. So those are kind of our primary educational goals right now.
Thank you.
All right, thank you all.
All right, let's This will, Shore Community Services, and then we're going to take a few-minute break. Is Shore here?
Yes.
I was looking for my colleague, but I guess she's going to wait. Hello, my name is Uma Mupiri. I am the Senior Director of Residential Services. Should I be louder? Yes. Okay. My name is Uma Mupiri, and I am the Senior Director of Residential Services at Shore Community Services. And our project contact is Mary Matz. She's our philanthropic officer at marymatz@shoreservices.org. Her telephone number is 847-982-2030. Our address is 8350 Laramie Avenue, Skokie, Illinois. And our Chief Executive Officer is India Alexis Ahioba. And our website is www.shoreservices.org. So I'm here to represent Shore Service as a residential director. I've been with Shore Services for now a year. So Shore Services started about 69 years ago. What started in a basement of a family because they were not able to, enable supports for their daughter with developmental disabilities. So now has evolved about this big Shore Services, which now provides about 400 individuals with developmental disabilities and other disabilities. So as you all know, because the developmental disabilities population, they have limited, representation, and most of them either are unable to vote or tend not to vote. We have limited representation at both the state and federal levels. So what we do is we basically give them the supports that they need and also represent them at both the state and federal levels. In some organizations like IRF, that is the Illinois Association of Rehabilitation Facilities, that represent us at both the state and federal levels. So I would say as of now, Shore serves over 350 individuals, and in 2019, we served about 319 individuals that were enrolled in our program. We basically represent our communities mostly coming from Skokie, Evanston, and Chicago. So as a residential director, we provide varied services of residential programs. So it varies from what the needs of the clients are. It might be for severe to profound needs to clients who are very independent. So our homes vary from like independent living, like the townhomes, where the residents mostly they do most of their chores by themselves, or they're very independent with intermittent supports, to our group homes, which we serve about 17 individuals, where we serve about 24-hour support services. We also have Shore Homes East and West that serve like they are 12-bed facilities, and again they are more like a transitional homes where we provide them supports, and if they become independent, they are transitioned into more independent settings like the townhomes. We also have home-based services, and we actually serve about 43 individuals. So these individuals are placed in the least restrictive settings with their families. And the supports we do is provide a home-based supports manager, which basically work with the families to ensure that they are getting the most outcomes, potential outcomes. And basically they help the families to hire personal support workers and other case management services and behavioral supports that they need. So I would say for the last 1 year, your funding has really helped us enable and add on behavioral services for our clients. As you all know, behavioral services is the must for today's needs. And we added 2 behavioral contractors who work diligently with our clients, giving them the behavioral supports they need. They basically train our staff to work with them and help mitigate the behaviors they have, and so that they can function in the community with their highest potentials. Again, most of our clients, either they go attend the day program or they work at the community settings. And our goal is to ensure that they are given equal rights in the community, and they can actually be in par with the other, population, So I would say most of our townhomes clients, they actually work in community settings, and our support service professionals work with them so that they are most independent. Your funding actually helps us, with the 6% of our salaries for our home manager at the townhome, and also the support service professionals who work with these clients. And these are like the crucial or quintessential elements of our staff, of our whole services. The other thing I would say is we are accredited by CARF International. We have 16 consecutive 3-year accreditation, which is the highest award of any prestigious organization, and April 2018 was our most recent, accreditation. We also have day program. We have 2 day programs, one at the site, the other is for community employment services. My colleague here who represents the day program, she's not here yet, but we do offer competitive employment for all the clients, and they have the choice either to work in a sheltered workshop or they can work outside depending on the needs, and we will give them the job code support that they need. At this point, so at this point, we really do not have any vacancies again in our staffing pattern, because we really have a low turnover in terms of staffing and also in terms of our vacancies. Most of our clients, because they have lifelong needs, although we do have a waiting list, and currently we have about 20 in our waiting list, because of our low turnover rate, most of the clients tend to live with us for lifelong. So again, your funding has helped us secure our behavioral services. For the coming year, we are seeking to $22K from you guys, because we are going to add another client in one of our in one of our group homes in Evanston. And we are actually going to add this extra client, so we will need that extra support and services. And also we have added a new case manager in our program. Again, out of 219 individuals, 19 live in our residential program. Out of 99, we have 34 who are from Evanston, which is a combination of townhomes, group homes, our intermittent homes, and also home-based services. We are planning to expand our home-based services, which is again the least restrictive environment, and we are planning to add 50 more clients, mostly from Skokie, Evanston area for next year. That is what we are doing right now, and really your support gives us this enormous support, because as you know, state funding is limited and there is only that much we can do, and we really rely on organizations like yours and to ensure that we keep providing the services our clients need. Any questions?
Thank you.
Thank you so much.
All right, it looks like we should take a few minute break, unless agencies are you at the board want to take a break, a few minute break?
I would appreciate
Okay,
that.
okay,
Yeah.
all right, 5-minute break. All right, let's resume. All the board members are back. We were scheduled to hear from Northwest Center Against Sexual Assault. Is there a representative? No. Is there, the next on the agenda would be Center for Independent Futures. Are they here?
Yes.
Are you guys prepared to begin? Okay, come on up.
Good morning. I'm Ann Sykon. I'm the Executive Director at Center for Independent Futures. We're located at 1015 Davis Street in Evanston. Our phone number is 847-328-2044, and our website is www.independentfutures.org. independentfutures.com. And with me today also is Geraldine Miller-Brown, who is our grant manager. So we will be splitting our presentation. I wanted to just take a few moments to speak about the need for mental health, specifically in the population of individuals who have intellectual and developmental disabilities. Nationally, 30 to 35% of people with intellectual and developmental disabilities also have a coexisting mental health challenge. 43% of those individuals from a national perspective indicate feeling lonely at least half the time, and over 1 out of 5 indicate that they have no other relationships other than paid relationships, be that paid help or family members who's helping them with something. 29.6% of individuals with disability live in poverty. We have the largest subgroup of poverty in the country. That's compared to 13% of individuals who don't have an intellectual and developmental disability. And 19% of individuals with intellectual or developmental disabilities are employed full-time or part-time, only 19%, compared to 65.9% of individuals who don't have that diagnosis or that challenge. The other thing also is 71% of people who have intellectual and developmental disabilities are living with caregivers. And many of those caregivers are over the age of 60. So we really have a continued crisis of who's going to provide that support to these individuals as their caregivers continue to age. In Illinois, we see really 44% of people, and I'm going to just say IDD, because that's kind of how intellectual and developmental disabilities are abbreviated. But 44% report being lonely. Over 19,000 residents in Illinois who have an IDD are on a waiting list in the state for services that they are eligible for, but it all depends on whether or not the state pulls their name, their number out of what's almost like a lottery to provide services. Of those 19,000, 7,000 are saying they need behavioral support. So the need is great. The funding is very limited here in Illinois for families and for individuals. In fact, Illinois continues to be in the bottom 5 states in the nation for funding for community services for people with IDD. In Evanston, people with disabilities were substantially more likely than people without disabilities to be living in poverty. According to our 2007 to 2011 American Community Survey, 24% of individuals, residents living with disabilities were living in poverty, whereas compared to 12% of those without disabilities. What we find at Center for Independent Futures, we reach out and really connect with over 100 Evanston residents monthly who have intellectual and developmental disabilities. Over 40% of those individuals have a coexisting mental health diagnosis. So your continued support in this area has really been terrifically instrumental in helping us to continue to provide some services that otherwise are simply not available for individuals. Jerry, you want to talk now more about our specific grant results?
Yeah, hello everyone. Yes, Jerry Miller-Brown, our Director of Grants at CIF. So we're very grateful for having received funding over the past 3 years from the Mental Health Board. I'll talk a little louder.
Yes.
Our request for fiscal year 2020 is very similar to what we had requested and hoped to provide for this year. So the first component has to do with conflict resolution group, and it meets twice a month. It's a group psychotherapy session facilitated by a licensed clinical psychologist, and it's supported 4 hours a week by one of our CIF staff who is involved from the inception. And to reinforce some of the learned strategies through the conflict resolution group. 9 individuals attend regularly, and the kind of things that they've been doing through the, at the conflict resolution group, they've been practicing perspective taking strategies as a tool for increased understanding and de-escalation of conflict. They're looking at trying to pay attention to nonverbal facial cues to understand what others might be thinking, and they're learning to understand their own triggers and to manage their own emotions. So that's in general helping them function in jobs and socially with their friends. We measure our outcomes. There's a conflict resolution self-questionnaire that our psychologists put together that people report on, and we kind of see changes. And we also have seen fewer crisis calls to staff, and the fact that the group members are utilizing some of the learned strategies in session. So that's positive.
I also just wanted to mention fewer crisis calls involving other first responders in the community, when individuals are able to better manage the way they respond to frustrations or things that before they escalate into a point where a first responder has to be involved.
So another component that we are hoping to continue and to fund through Mental Health Board is it's a monthly transition house social hour, and it engages Evanston Township High School transition students. They're ages 19 through 21. They've graduated from high school, but they're still entitled to special education services. So we hold those twice a month at CIF. About 10 students come each month, and the attendees are primarily students of color from low-income households. It gives them a chance to chill out and connect with each other and kind of solidify these relationships that are going to become very important as they graduate. They have connections. So actually, transition students typically have few social connections apart from their school peers, and many exit school programs exit school with very few programs or services to help them adjust to adult living, leaving many of them socially isolated, lonely, and prone to depression. So the Transition House Social Hour gives them a welcoming space. They can build connections and social skills, and it also introduces them to CIF as a resource for their futures.
We also see that many times, for students with disabilities who are receiving ongoing services after that 12th grade year, those services stop the day before they turn 22. It doesn't matter when in the school year. It's not like you conclude a school year and you just won't be going back in the fall. It could be, January 14th, it could be March 17th, it could be any day.
The day before your 22nd
the day
birthday.
before you turn 22, all of a sudden your life changes. You can't go back to school anymore. You can't be with your friends or even getting the supports that you were getting if it was an employment position. All those things stop at the day you turn 22. So a lot of what we also see are transition students who have turned 22, right? This continues to be a place where they can reconnect with friends that otherwise there's no way for them to go back to the transition house and connect with people.
And as some outcomes, we've seen, definitely that some of the students are building social connections outside of the school day as a result of the transition social hour. And they're even building skills, transportation skills that they're learning to get there and back. That's going to help them in their adult years, again, to stay engaged and not be socially isolated at home alone. And some of the transition students who have recently graduated have begun to come to our regular social hour and become part of the full CIF community. So that's been another, wonderful outcome. A third area that we are looking for funding for is to have two mental health in-service trainings, specifically by Drs. Chabin and Fox. Dr. Fox actually facilitates our conflict resolution group, but the two work a lot with individuals with IDD, and our staff know them as well, because as Anna said, 40% of our participants have a dual diagnosis of IDD and mental health. It helps our staff better recognize, issues, and even our direct services, but even our admin staff, they're usually the ones in the front line when our participants come in, and for the whole staff to have that knowledge and greater understanding, it just improves, and it just, the interactions and understanding of supporting the individuals with disabilities that we work with.
And I just want to mention that these two practitioners have exceptional knowledge and experience both in the IDD world and in mental health. And it's a very difficult blend to find in a psychologist or psychiatrist who has experience in both. And often for people who have IDD, if they're seeing a psychologist or psychiatrist, that person, if they're not familiar with all the issues regarding IDD, may misinterpret someone's lack of response or kind of unusual response, or ability, what's needed maybe for the length of time it takes to respond, even verbally, to be able to process language and gather an answer much differently than someone who understands that this could be part of the IDD and able to still provide that support. So any questions?
I just actually have a curiosity question. So what are the most common mental health or mental illnesses seen in the IDD community?
Anxiety, depression would be the biggest chunk. But we also see people with bipolar, borderline personality disorder, schizophrenia type of related diagnoses also.
Any other questions? Great, thank you.
Thank you so much. We greatly appreciate your support. It's really making something possible that isn't there and isn't funded anywhere else.
And actually, there's some handouts, the two sheets we can share with you later. Thank you.
Thank you. All right. One more time for Northwest Center, the conceptual solve. Okay. All right. Well, we're moving on. I want to thank everybody for their presentation and the work that they do here in Evanston. Our next agenda item would be the public and staff comment. Yes.
Good morning. My name is Stephen Vick. I'm the Executive Director of the Infant Welfare Society of Evanston. We're located at 2200 Main Street. Our phone number is 847-491-9650, and our email is www.iwse.org. We are all here today to humbly request a reconsideration of the denial of our application. I'm here specifically to acknowledge our negligence and error in being late with the application. The application was due Monday the 21st, and I was made aware that it was not submitted on the 23rd after receiving a Zoom grants notification and going into the system and seeing that our application was not there. The Infant Welfare Society of Evanston, since this news, has really been devastated, and it's been a very difficult situation for us. But as executive director, I want to take responsibility. We have 50 staff and 3 sites and many different programs, but ultimately, I am the oversight of it all. And so I wanted to come and take that responsibility and also ensure that this situation has been rectified internally and will never happen again. In the 5 years I have been here, I've worked very closely with the Mental Health Board and CDBG, participating, presenting in front of this board. In this application in years past, I'm very much involved in the writing of the LOI, working with the development department, clarifying language, working with our site director, making sure that everything is where it needs to be. This is $65,000 that we requested, approximately 13% of the teen baby nursery budget. It's a substantial amount of our programming and truly a devastating impact not to receive it. We have had teen baby nursery open for over 20 years at the request of the city of Evanston. It was requested of us in partnership with District 202, the high school, because of our early childhood expertise and parent expertise, to serve one of the most vulnerable populations in Evanston, which is parents ages 14 to 23, and their infant and toddler children ages 0 to 3. I would tell you that we do exceptional work. Our staff work diligently. Our board, our organization works tirelessly to serve this population. We serve a predominantly 85% low income, predominantly black and brown population in Evanston, are at the front lines of the disparity gap in this community. Teen baby nursery, I will tell you, and our director, Tiffany, will talk in a second about more specifically about our services. But I will tell you that the partnership that we've had with the Mental Health Board, District 202, the city, has been invaluable to provide these resources. We are a partner of District 65 and a early Head Start delegate of District 65, and actually the largest early Head Start provider in the city of Evanston, larger than District 65. We believe and see ourselves as one of the experts in prenatal to 3-year-old care. We actually, in the 5th Ward, where our teen baby nursery is in the Family Focus building, are the only representative of District 65 in the city in that 5th Ward. And we serve that community diligently. So again, for my part, I wanted to take oversight responsibility as the executive director. That is my responsibility for every operation and every program. And my comment to you is that this one incident of negligence has been severely looked at, and internal operations are being changed to make sure this never happens again. And in my tenure here, this has never happened before. I'm going to pass the podium to Tiffany Culpepper, who's our site director, to speak a little more about the actual program. But I do humbly request a reconsideration of our denial of application, specifically because of the impact that it will have on our children and desperately needy families. Tiffany.
Good morning, everyone. My name is Tiffany Culpepper, and I am the site director of Teen Baby Nursery. We are accredited by the National Association of Education for the Young Child, which is NACI, and we have the state standard of high quality through Accelerate Gold. So that right there shows you the importance of early learning and education. Now, some of our teens that Steve has mentioned are between the ages of 14 and 23, and they have come to us broken with this new responsibility of being a young parent and not knowing what to do. And what we have done in the nursery is support them, but also providing care for their children while they're in school. Many of them have fallen into depression, feeling like a failure because they are young parents, and we have helped them to gain their confidence and supporting them through the services that we offer them and giving them the best fighting chance to be successful adults in the future. We appreciate the funds that have been given to us by the Mental Health Board, and we truly anticipate that we can continue to receive those funds so that we can continue to provide the services to the families. A lot of the teens need assistance with knowing what to do with the rest of their life. They need guidance, they need support, and that's what we give them. In my time as a director over the 3 years that I have been there, we have had a goal of assisting these parents to become advocates, to finish high school, to pursue higher education, to join a job vocational program if traditional schooling is not right for them. Just giving them a fighting chance and knowing while they're doing these things, their children are in a learning environment that supports them too. This funding that we have received has allowed us to provide monthly workshops for the parents on topics such as postpartum depression, which many of our young mothers have gone through, job stability, what do they need, self-wellness and care, because a lot of our teen parents are struggling with mental illness and not knowing how to cope with that. The funds have supported our family advocate who meets with these parents periodically, regularly, to help keep them on track. And when we think about the children that we have in our care daily, many of them are highly dysregulated. Social emotional development is a huge component in growing up, not only for the children that we care for, but for the parents as well. And so a lot of the time we spend trying to help develop this area of development that's crucial in learning. The financial support that we have received has helped give them the opportunity to further in their education, but allow us to provide the staff the support that we need to continue to provide these services, such as a mental health consultant that comes weekly to meet with our team and the parents and observe the children as well. Part of our mission of infant welfare is to help parents to become advocates, to further advance their educational learning, but to also to support their children as well. Over 25% of the children that are in our care have developmental delays, and that is huge for such a small population. We're serving infants from age 6 weeks to 3 years old, and that large amount of a delay, it needs help of a highly dedicated and qualified team to provide that. So the funds that we receive in part helps us to do that. I'm asking, like Steve, to reconsider our error that of not having an application in on time. We are truly sorry for that, but the impact of not receiving the funds is far greater than anything that we can imagine, because we are situated in the 5th Ward, a very vulnerable community, and our teens, our young adults, they need us. They need the support that we give them.
Good morning. I'm Martin Handler. I'm a professor and director of the Center of Excellence in Maternal and Child Health at the University of Illinois School of Public Health. And I'm a board member of the Infant Welfare Society of Evanston. And my research expertise is on the impact of inadequate systems of care on women's and infants' health and well-being. And I'm really grateful that you're taking the time today to listen to us and to our concerns and those of my colleagues. I'm also here today because of the vital importance of Teen Baby Nursery to the city of Evanston. And I would like you to reconsider your decision to deny our $65,000 grant application for 2020. And Steve's already talked to you about our error and how sorry we are and how this will never happen again. But denial of this grant may not lead to Teen Baby Nursery closing immediately, but it will long-term put the entire operation in jeopardy, and we'll have to close probably within a couple of years, which, as Tiffany just described, would be a huge impact on the 5th Ward and the city of Evanston. As you've already heard, Teen Baby Nursery serves the youngest and most vulnerable parents in the city of Evanston, those 14 to 23. These families and their very young children, as you know, face major obstacles to health and well-being, including abuse, trauma, mental health concerns, depression, postpartum depression, and often housing and food insecurity. And we all know, we've all read the literature, right? We've all read these articles that teen moms in the U.S., are less likely to finish high school, and they have higher rates of poverty, and more likely to have higher rates of depression and other mental health issues, and that their impact on teen pregnancy is not just on the women themselves and on their partners, but on their children. We know children of teen mothers are less likely to be ready for school, and they're more likely to have poor educational outcomes, behavioral outcomes, and other adverse health outcomes over the whole course of their lives, not just as children. And that's not because being a young mom is inherently a risk factor, makes you a bad person. It's just because these parents face so many obstacles, and they do not have sufficient resources to handle all the stresses and all the responsibilities that come with parenthood. And in a world that I say provides very little support for youth in general, and particularly for youth of color. The good news, though, is becoming a teen parent or being born a teen parent doesn't mean that you have to have these adverse outcomes. What we know from research is that teens who receive school-based prenatal care, school-based child care, and or parent support programs like Teen Baby Nursery have significantly improved outcomes. And as Tiffany reported, we've witnessed this with our own eyes.
Providing vulnerable parents with day-to-day support really has made a huge difference, and it can make the difference between success or failure. In fact, over the last several years, all of our teens have graduated high school, and many have gone on to college and/or employment. Without Teen Baby Nursery and its dedicated and hardworking staff providing these supports in Evanston, I think our most vulnerable youth and their babies are going to be left out in the cold. In a city which touts all of its commitments to ensuring healthy and successful infants and children and cradle to career, to me, I feel like this will be a huge embarrassment if we close Teen Baby Nursery. It will be a stain on the commitment of our city to the health and well-being of the citizens across the life course, and also a strain, I feel, on the entire Evanston community, because what will happen is ultimately these teens will need additional services and others of the mental health programs we've heard about today if we don't do something early in terms of prevention. I hope that as members of the Evanston Mental Health Board, you'll recognize the seriousness of not providing funds to Teen Baby Nursery and reverse your decision, or if you're unable to do that, advocate for us at the full City Council meeting, and I thank you for your attention and consideration.
Okay, being the last person, I'm going to undoubtedly repeat some things that you've already heard. My name is Marcia Richmond, and I am speaking to you as a longtime resident of Evanston for over 45 years. I've raised my family here. I've been an early childhood professional within the city, and I've been the board chair for the last 2 years of the Infant Welfare Society of Evanston. Thank you for allowing me to address you today. Admittedly, the organization has made a big mistake, and we're taking the steps to make sure that doesn't happen again. Teen Baby, as you've heard, was created in 1999 at Family Focus at the request of the city. For the first several years, the amount granted by the Mental Health Board was $80,000. And we've served the teens at the high school up to age 23, supporting them with family advocates who meet with the teens in places convenient for the teens and young adults. And last year, we had a mom in the program who was 14 years old. Can you imagine, how much support she needed? In recent years, all our teens have graduated from high school. Many have gone to college or entered the workforce. As poverty levels continue to rise in our communities, we need to do more to provide our most vulnerable families with the tools and the foundation they so desperately need. And it costs more. And in my experience as an early childhood educator, I had the pleasure of going into baby toddler as a NACI validator, and I was very impressed. This was way back in the 90s, and for those of you who've been in Evanston for a long time, it was when Mary Jane Chainsky was the director. Today, I'm still impressed, as others who visit our centers. The quality of the care delivered at Teen Baby Nursery and Baby Toddler is exceptional, and I visited a lot of centers throughout the metropolitan area as an early childhood professional at National in DePaul. And after being a director at a few centers myself. From directors Mary Jane Chainsky to Megan Kashner to Cass Wolf and our present executive director Steve Vick, IWSC has always stood for leadership and foresight in the field of early childhood, and we hope to continue to be at the forefront for many more years, but it is a constant struggle financially. We're constantly working to maintain a healthy balance of institutional existence and growth. It's a constant challenge on which we work hard as a board. Infant Welfare of Evanston was started in 1913. And over our 107-year history, we've done lots of very different things, from delivering pasteurized milk, to supporting all the needs of modern society. Demands for documentation and services for children for government funding sources and accreditation institutions grow. The impact of the dollars that fund our programs do not grow as quickly, and the gap between the cost of care and the revenue to pay for it continues to widen, and we are committed to narrowing that gap. with fundraising. In the 8 years that I have been on the board, the focus of the board has broadened to including much more fundraising, and we have seen an increase over the past 5 years to raise money while the need for more funds outpaces our ability to fundraise. We continue to run this race because it's an important race to run. We take our responsibilities as board members seriously and implore you to reconsider accepting our application for funding. As a long-term resident and citizen of Evanston and a passionate early childhood professional, I hope the city will continue to support us in the life-changing work that IWSE does. Together we can make a difference. Thank you.
Thank you.
Are there any comments or concerns or questions for?
I missed the meeting last week. Was this decided, the board decided to deny it last week?
At the last month, at the meeting on November 6th.
The last month, yeah.
The 7th.
November
The
7th.
Thursday night meeting.
It was a joint meeting between the Housing and Community Development Act Committee, which allocates CDBG, the Community Development Block Grant Fund, and Mental Health Board. So because there were applicants requesting both Mental Health Board and CDBG funds, the bodies voted separately. I'm sorry, I should say applicants that were requesting both funds that missed the deadline. So both bodies took a vote to decide whether or not to uphold that application deadline or to waive it. So at the time, there were 5 mental health board members and HCDA, and both bodies voted to uphold the application deadline.
And we have actually waived the application deadline for another organization, correct?
No.
We
So
cannot.
agencies in the past have missed the deadline to submit the letter of intent.
The letter of intent, okay.
And agencies have missed the mandatory application meetings, sorry. And at that time, it came to the board to decide whether or not to let those applicants move forward or.
Has anyone ever missed a deadline for the
Yes.
actual application?
Submitting? Yes. Not for the mental health board in my tenure as board staff, but the Housing Opportunities missed the deadline to submit for the Community Development Block Grant Fund.
And how was that handled?
They were not allowed to move forward. The deadline wasn't held.
I would just like to mention that I happen to support the 2 agencies, and I brought that up because I know that mistakes are made. And the aldermen who chair the mental health, who chair the community development board really shot me down. I mean, that was, that there are deadlines, and we have to respect deadlines, et cetera. So the other agency, I guess, is not here today that missed the deadline. And my question is, and I abstained. I did not, support the motion. But I guess my question would be now, what happens with the other agency? If the board decides to move ahead. And the other thing I'd like to mention is that it's really the council who has the authority to agree with our allocations, our recommended allocations. It's really, the mental health board can submit what they believe is fair, but it's really the council members who make the decision as to move ahead.
So that's true. One of the processes that we're required to uphold is to review all applications in a public forum. So I don't know if you guys noticed the length of our packet for this meeting. Sorry. The board members who voted in favor of the winning motion, which is to uphold the deadline, or let me say, if that application were to move forward, it would need to be reviewed in the public process. So it's unclear if that would happen at the city council level. The challenge is, the city, there needs to be a process, and we need to uphold that process. And whatever that process is moving forward, we need to uphold it. And we need to follow the guidelines of the Freedom of Information Act and to the Open Meetings Act when reviewing requests for public dollars. So, the guidance that I've received from our legal department is, if members who voted to uphold the application process, if one of those members wanted to open up this process for review, that review would take place. It would have to be placed on an agenda. That review would take place at a subsequent meeting. The mental health board would then vote as a whole board as to whether or not the application would move forward. And then there would be another meeting. And so it's not just about one applicant. It's about all of the applicants that missed the deadline and what our process is moving forward. So if for this year, the board decided to waive the deadline, it would be open then to all applicants that missed. And those applicants would need to be reviewed at another public meeting. Ideally before our allocation meeting, assuming that could work out, unless we hold up the allocations, which we could. It's tough with the holidays, so I don't want to hold us to like an unnatural deadline. We could move into January and February. Then the mental health board allocations are reviewed at the Human Services Committee level and then at City Council.
Just for clarification, if I might ask, from what you're saying, it sounds as though if we are to waive the deadline for one or more agencies at this point, then we essentially have to reopen the application?
If it was, so the decision to waive the deadline would have to be an agenda item at a subsequent meeting. And yes, it would be then open again.
It would not be able to be discussed right now?
Correct. It wasn't on the agenda.
So at this point, to move forward to accept the application, somebody on our board who denied it initially would need to open it up, okay? Which can't be me. So if somebody is interested in doing that, that would be the time.
And then we take a vote on that?
No, there will be no votes at this meeting.
All right, I'll open it up.
That's Dr. Haynes.
So for opening it up, if we were in theory to allow anyone who missed the deadline, are we allowed to specify that it's only if you miss the deadline for the actual application, not for like the letter of intent or like anything else, just the final process? So like we kind of eliminate anyone who missed that specific part. Okay.
Yes.
Let me ask you a question. Do you have any idea how many people have submitted a letter of intent that never went through with the process? In other words, are there 10 more agencies that we might need to consider, or?
No, I would not want to speak to that at this point.
Okay.
So at this point, we're really looking at 2 agencies who missed the deadline for submitting applications.
And at this meeting, we are suggesting that we will open up another meeting that needs to be scheduled, having this be an agenda item to reconsider.
Assuming we're ending public comment, this flows very nicely into staff report.
Excuse me,
let us finish the public comment first, I think, section, and staff report, and then we'll have Jim, who's from, okay, so give us just a minute.
Yes, definitely,
Yes.
please.
Oh,
I didn't mean to cut it off. We can-
Yes, sorry.
I just,
Public comment in support of this agenda item?
yes,
Okay.
yes. Yes, I just proudly stand here as a partner to Infant Welfare Society of Evanston on behalf of Childcare Network of Evanston. The program itself is a very well-established, community-based program, which I'm sure you all are already convinced of, but I wanted you to know that C&E felt that very strongly about that. They keep families connected, and they care for babies, and they really change the future of those lives and residents of Evanston. And I proudly support them.
A similar comment, having been executive director of a small nonprofit for 2.5 years, I know how hard it is to keep all the balls in the air and make sure they all land exactly when they're supposed to. We unfortunately missed the mandatory meeting last year, and the board was very gracious in allowing us to go ahead and make our application. I did the same thing Stephen did and came and made this request and promised it would never happen again. It did not happen this year. And so from the side of thinking about all of our good intentions and sometimes we make mistakes, I just want to thank you for your graciousness in the past and your understanding about how hard the work is, and would definitely encourage the reconsideration of the 2 people who missed the deadline. So thank you.
Any more comments in support of infant child welfare? Okay, all right. Now we should move on to other staff report.
Yes.
And then Jim.
So this is, my report is mostly housekeeping. There is a memo with some guidelines. I'd be happy to answer any questions about the memo. Some key things that we ask board members to consider is the number of Evanston residents served and the program's capacity to provide services to Evanston residents, and balance that with the amount requested and prior year awards if applicable. City funds, as a guideline, should not exceed 30% of the program budget, but that is a guideline. And we are looking at equity very closely here at the city, so the hope is that city funds are used to expand the program's capacity specifically to marginalized populations that have been hurt by institutional racism specifically. And finally, grants under a $10,000 award amount are often take a lot of administrative work on the agency's part to administer. So we just be mindful of that. And then finally, for the allocation meeting, I don't know if I should talk about this now, I'm happy to talk about it later, but there is that scoring option in Zoom grants, so I just wanted to give people a chance to see if they've used the scoring option or if there are any questions. Please score all applicants unless you need to rescind or recuse, and then just don't fill in anything. In prior years, members have not provided award amounts. That does not need to be the way we do things this year, but it would certainly be in keeping with the way we've done things in prior years.
Jessica, based on what the current, I guess, would you say motion, or what just happened? What does that mean in terms of our schedule?
Well, Yeah, we're gonna talk about that next.
Yes, yes, yes.
So let's talk about additional
Yes,
meetings.
yeah, we'll have to figure out, now we need to figure out dates to have a meeting to read, or we're gonna have a meeting to open the agenda item, I guess, or vote.
So when we
Vote.
have this meeting to open the agenda item, will we also have a presentation from the two agencies, or will that come later? So we're,
That would come later, assuming the vote to waive the deadline carries.
Yeah.
This is our process.
And when's the allocation meeting? That's the December meeting?
The next meeting is
yeah.
currently scheduled for December 12th. But that agenda hasn't been posted, it hasn't, we're.
Okay.
And that's the meeting where things have to be ranked or rated, or?
Not necessarily.
not anymore.
No.
That was.
Things may get pushed back here. So
Yes.
how about we everybody look at their calendars now, just for a meeting. It will be short and brief, right? Or hopefully, I'm sure there'll be some discussion. But we need to look at a meeting to review this agenda and vote on this agenda item. So we're consistent with Thursdays. I don't know if that's best for people.
So then the 5th is the first Thursday of December.
We have, this coming Thursday is November 21st. You know, they left. Oh, they don't need to be here for that, I'm
No.
sorry.
The 21st works for me.
It works for me as well.
I can do 21st.
Yeah.
Doesn't
Doesn't.
Yeah, it doesn't for me.
It doesn't for me, it doesn't for me.
You know, I could
Does
send
not.
out
No.
a doodle poll if it's easier. I could
Yeah.
send out a doodle poll.
Yeah, we definitely want a
everything on the
quorum
table.
there.
Yes.
Yeah. Well, let's then look at November 21st as one day, and then.
Well, I think we already said there are several people that can't make that.
Yeah.
I don't think we'll have a, did you say yes or
But
no?
I
can, yes.
You can,
I
and I
feel
can,
like-
and you can.
I feel like part of the problem is that there weren't that many people there last
Yeah.
time.
Yeah.
For us to really,
Yeah.
you know, and I think it makes sense.
Mhm.
In making a decision like this, we should have as
Yes.
many people as possible.
Yeah.
Okay. So then I guess the following Thursday after the
That's Thanksgiving.
holiday.
That's
No, I
Thanksgiving.
mean that,
Yeah.
The
after
5th.
Thanksgiving.
So that would be the 5th.
In December or November. You know what, I really will, if we can just generate a couple of dates, my
Yes.
goal right now is not to lock down quorum,
Yes,
but to
yes.
just
Yeah.
get some dates that I can put out. I'll do the
Okay.
poll.
Yes.
and come back.
Well, if we had it on the 12th, I mean, is that the regularly scheduled
That's a
meeting?
regular scheduled meeting,
Yep,
yeah.
that is, yep. And so then maybe do we want
I
to look
see.
at additional meetings beyond the
Yeah.
12th in case we can't get enough meetings before then? The 12th is regularly scheduled, so we can have the vote then. We could have the vote November 21st. We could hear applications on the 12th and then move into the allocation meeting at another date. And I guess, I mean, it really doesn't have to be December if this gets challenging with the holidays and travel schedules. If we move into January, the only thing I would say is it then pushes back when this recommendation goes to Human Services. Human Services typically meets the first Monday of every month, and then after Human Services, it goes on to City Council. If we can get it to Human Services, we can usually get it to City Council in the same month that it goes to Human Services, assuming they don't cancel their meetings. So I'm happy to send out dates, or I'm happy to send out the poll for November 21st, December 5th. Nobody make any plans for the 12th, that one's still ours. And then perhaps I can find some of like December 17th or the 19th.
Yeah.
Great.
Well, but can you offer clarification again? So if what we're doing at this next meeting is voting on whether we approve or continue with the
Application deadline.
Yes, the application.
We want to waive that application deadline.
Yeah. But thereafter, we still have to have a meeting to actually hear.
Assuming the application deadline is waived.
Yes.
Yes, and the agencies come forward with applications, then yes.
Okay.
And then we'll have our allocation.
And then we have the allocation.
And the allocation meeting, that was the one that was originally scheduled for December 12th, is that right? Okay.
Yeah.
Okay, so yeah, we have to add 2 meetings essentially before the allocation. Okay. All right.
That's okay. Still.
It's doable.
Okay.
All right, so that does it for me for staff. We can talk
Okay.
about
Okay.
scoring and all the rest at another meeting.
Now, I know one of the things I was to do was also to see whether or not we needed to develop, we have time now, so whether I need to, well, let me just put this out there so people can think about. We will need at least 2 people, a subcommittee, if you will, once all the applications are in, if that's where we're going, a subcommittee, a couple of people on this board that will put dollar amounts based upon the applications that have been approved. So we need somebody, volunteers, to do that. We've historically, I know at least for the last few years, there have been 2 people who have done that. But I think now we have a little more time. So I just want people to think about whether they'd be interested in doing that. Okay. For all those applications that have been approved. Okay. All right. And I guess Jim is here from, so I think we should make room for Jim to present on the Northwest Center.
I'm so sorry about missing my time. I thought I was scheduled for later than 10:30. Okay. My name is Jim Hunick. I'm the Executive Director of the Northwest Center Against Sexual Assault. We are a comprehensive sexual assault trauma center that serves all of northwest suburban Cook County and also McHenry County. The program that we're requesting funding for is our sexual assault intervention program. And that specifically provides services to victims of sexual assault, trauma-informed counseling. We do a 24/7 crisis line. We have 24/7 medical advocacy. And that's at 12 hospitals, so we cover the 2 hospitals here in Evanston as well. And then we also provide crisis intervention, both in person and over our hotline. Our website is www.nwcasa.org. You can contact our website to reach our office or at office@nwcasa.org. And our phone number is 847-806-6526. I want to thank you for your support of Northwest CASA. Our location, we have 3 locations. One is in Arlington Heights, that's our main office. We have an office in McHenry because we serve victims of sexual assault in McHenry. And then we have office right here, just down the hallway here. We have 3 offices that we rent from the city of Evanston. And this is where we provide counseling and advocacy services on site to victims of sexual assault. While we so appreciate your support, we try to get support funding from everyone. And one of our primary funders is the Illinois Coalition Against Sexual Assault, which is a statewide group that's a pass-through for a lot of federal and state money that's targeted for services for sexual assault victims. And what's important about ICASA is that they have standards of care. And so we have to meet those standards in terms of the staffing, the credentialing, the training that all staff have to provide. They also monitor us every 2 years. They come and do site visit to make sure we're meeting their standards. And they also come in every 2 years and review our fiscal operation, make sure it's in compliance with state and federal regulations. And I've been there 11 years, and we've never had a problem in either of those reviews. So I think we do a pretty good job. One of the things I want to stress with you all, since you're responsible for public monies, is that the outcomes are important to us, as I'm sure they're important to you. We measure almost everything we do in ways that are not intrusive to our clients. For example, every 6 months we ask all of our clients to complete evaluations of their counseling experience, and they report that anonymously. And we do this twice a year, and our last review was in March. And of the clients who responded, 96% reported that they saw an increased capacity to cope with the symptoms of trauma since they came to our program. 91% reported a decrease in their anxiety and fear since receiving services from us. And 88% reported an improved quality of life since obtaining services from us. Now with our advocacy service, so it's mostly a crisis. We go into the hospitals 24/7. We have agreements with Evanston, St. Francis hospitals, where as soon as a victim comes into the emergency room, they contact us. We send a person out there who's trained in the whole forensic evidence collection process, who knows the victim's rights, and who advocates for the victim in that whole process. And those hospital calls can last 3 or 4 hours. And what we do with those survivors that we serve is 6 months later, we contact them, partly to see if they need any services. Some of them are already getting services from us, but partly to ask them, how did we do 6 months ago in the emergency room? And consistently, they report well over 95% feel understood, supported, well-informed of the process they went through. So it's important for me that you know that the service that you're supporting is highly professional and effective. In addition to those measures, we also use standardized measures to evaluate our counseling. There's a standardized measure called the Trauma Symptom Inventory. John Briere, who's an expert in that field, developed it. And we administer that when a counseling client first comes for counseling. And it gives us a baseline for the things that they're going through. There's 11 different domains, and it measures each one. And it gives us a baseline and also an indication of where the individual is having the most difficulty. And so part of the early stages of treatment really are to discuss the report and some of the symptoms they're facing. And then part of the service planning is, these are some of the things we see in the TSI that may bother you. What do you want to get out of counseling? And then the counselor and the survivor put together a work plan to address those wants and needs. We generally evaluate our TSIs every year, and our last one was in April of this year, and consistently shows that there's a symptom reduction in the first 3 months of counseling that survivors receive from us. again, another measure that the work that we're doing is helping the people in need. The other thing you need to know about everything we do is it's all free. We charge for nothing that we do. We put no limit on counseling services. As long as the individual is working on their trauma and recovering from their trauma, we will continue to support them in any way that we can. Last year, we served 49 residents of Evanston with our services. And 13 of them received the medical advocacy, subsequent advocacy after that. 16 received ongoing trauma-informed counseling. 15 received crisis intervention, and then 4 Evanston residents were involved in the criminal justice process. So we accompany them to court. We interface with the state's attorney's office so that their rights are protected, that they feel they're well informed, and we generally want them to know what their options are in every stage of that process. One of the questions that you wanted us to respond to was the issue of diversity and equity. And we take that mission very seriously. As part of our mission statement as an agency, we are committed to reaching out to underserved survivors in our communities. We have 18 staff, and 7 of those staff are bicultural, bilingual staff, because we're finding that there's a growing need for Spanish-speaking services at all of our locations. In fact, 2 of the 3 counselors that work out of this office are Spanish-speaking counselors. And so that's a much-needed service in all the communities. And I believe about 11% of the population of Evanston are Hispanic. So we're deeply committed to better serving that population. We're also working with the Center on Halstead to receive additional training on how to work with the LGBTQ community. And that's an area we need to grow. We're looking at our website, our business cards, our waiting rooms to ensure that they're much more welcoming and it would create a sense of inclusion for anyone who comes to us. In fact, in our one waiting room at Arlington Heights, we have books that people can take or read or whatever. And in addition to all the books that are there, we also have a Bible, a Quran, and a Torah, so that people of any faith can, if they use those books for consolation, they're welcome to them as far as we're concerned. We also have a staff work group that is looking at issues of equity and diversity. We just spent 4 months looking at the book White Fragility, and we purchased copies for every staff and used the questions that were developed by the author to really talk about ourselves, really, in terms of how open we are, how inclusive we are, the language we use. This work group is now working on another area of inclusion. I couldn't tell you what exactly they will come up with. It's a staff operation, so they get together and they recommend what works for us to do. But we're deeply committed to that. We're also developing what we call a racial justice plan in our operations that addresses issues related to our volunteer base, our board base, our staff base, to ensure that we're fair, non-discriminatory, and open to all survivors of sexual violence. Again, Thank you for staying a little later to hear me out. I appreciate it.
Are there any questions?
We're glad he's here.
Yeah.
The agency is serving our folks.
I just wanted to make one mention that working with Northwest CASA for Center for Independent Futures, we have national studies show between 90 to 95% of all women with intellectual and developmental disabilities will be sexually assaulted. And the work your staff has been doing with our staff in making sure that your approach and your curriculum is accessible to people with intellectual and developmental disabilities is really greatly appreciated for what your staff is doing with us on that too. I just want to mention how you're looking at all areas of diversity.
Thank you.
Thank you.
Okay, thank you. Have a good weekend.
Thank you. All right, we did it. We are adjourned.
No, can I get a motion in
Can I get a motion to?
Motion to adjourn.
Yay.
Seconded.